Hi, everyone. Good afternoon. How are you doing out there? Well, it's a little chilly here where I am, but I'm okay. How about you? I want to welcome you to the Empowering New Nurses show. I'm Dr. Miriam Smith, the host. I want to say thanks for coming on. I know you could have been somewhere else, but you have chosen to be here, and I appreciate it. We appreciate it. My young nurses, my senior nurses, my nurses who have retired and just watching, I want to welcome you. I want to welcome you. So today, from my book, Nurse, the guide to empower new nurses into delivery of high quality care to all patients. The section on section 4, tips for succeeding as a nurse, as a new nurse. This is what it looks like. Section 4. Yes, from my book. On page, there's some tips, there's some suggestions. See, having worked as a nurse educator for many years, there were times I had to, on onboarding and orientation, I had to go through certain skills with my new nurses. And so from that, I've mentioned some of the tips that I've used along the way, in addition to others. One of them, okay, as a new nurse, the defibrillator. It's important to know its location and the policies that go with that. Now, defibrillators must be checked regularly according to your institution's policy. Usually done, and it's usually done. It's usually done in each shift. So, like for example, if it's a 12-hour shift, the night nurse would check as soon as they come on. Someone would be designated to do that. In the morning shift, when someone comes on, they would also, that's a responsibility. But every nurse should know how it's being used, how to use it. So practice its use. And there are times you have to manually test, and the number of joules used, you should know that in accordance with your hospital's policy. Example can be tested on 30 joules, for example, and the documentation on the logbook for the checks should be there. And of course, it will be indicated there. It's so important to document all information, including the expiration date of the defibrillator pads and of the content in the drawers. That's so important. So don't take it for granted. If you're not sure, ask one of the other nurses until you get to know it. Or if you have to go to the educator, that shouldn't be a problem. Call the educator if you're not comfortable until you get it and you know how it's done. Because once there's a code, you're going to push your card. And of course, the defibrillator is a part of the whole process that you'll be using. So that's just one of the tips in this book. And there are several tips here. Okay, I'll maybe share another one or two with you. Okay, on page 80, it says, before leaving a patient, ask whether there is anything else that you can do there at the time since you're going to see another patient. And I would encourage you to give a time frame. Give a time frame rather than say, for example, I'll be back 10 o'clock. You never know if 10 o'clock you'll be there. So sort of give a time frame. For example, I'll be there anywhere from 10 to 10:15. Give that slot, give that time frame so that when they see you come, they will, and when 10 o'clock comes, they won't be anxious because you're giving them a little time. You can come in between that time. Is that clear? That's great. All right. And you're going to keep your patient's bed at its lowest level. That will minimize any danger. If they fall, it wouldn't be as impactful negatively. Okay. Don't try it to pass unnoticed. You're an important part of the team. Make yourself visible on the unit. Although you might be a new nurse, you also have information to share. You're also a part of the team, and your input is important. So I have like about 26 of them. And I have also on number 11 says individual patients are unique and should be treated with respect, valued for who they are and for their individuality. Yes, we know that it's not a one package that fits all. We care for patients from all different backgrounds, ethnicity, socioeconomic status, age, gender, educated, uneducated, a big bucket with a lot of different, what you would say, different individuals. Individuals are unique and should be treated in that way. And therefore, the patient satisfaction will escalate if you offer that care. I put it in a package and say culturally congruent care. Bear that in mind as you care for your patients today. And in the same breath, as you interact with the interprofessional team, you see they're individuals and not a group. The individuals make up the team, and team is aware of their roles, but contribute or collaborate the effort for the care of that patient. So, patient satisfaction, nurses satisfaction, interprofessional team satisfaction, all come together to make one. And that patient is number one. And all the contributors putting their input can make a difference in the care of the patient. Thanks for listening. You can connect with me on YouTube, Miriam Amanda Smith. I would like you to subscribe or comment and share. If there's a topic you'd like us to discuss, feel free to put it in the chat. Now you can also connect with me on Instagram at podcastmare. Also, and my podcast is Empowering New Nurses. Now, coming soon, you'll be hearing some of my experiences, and you'll hear about encounters of the patient. So you got to come on and you will listen. Yes. Thanks so much for coming on. Have a great evening. We appreciate you. Bye.